Greetings, I be to Madam Shirley. Today, we will be presenting for PHY310 video presentation entitled Radiographic Testing is a non-destructive testing method. Before we begin, let me introduce my team members. This team consists of 3 members including me, Nick DAYANG DAMIA QAISARA, Abu Bakar FARID, and HUSNA MAISARAH. In this video, we will be covering for the introduction, self-awareness, social responsibility, conclusion, and also the reference.
Hello, my name is Abu Bakar Farid bin Michael. My serial number is 2021201554 and I will present for introduction and conclusion. So for the first part, the introduction, what is the definition of radiographic test? A radiographic test, also known as radiography or X-ray examination, is a medical imaging technique used to visualize the internal structures of the body. It involves the use of X-rays, which are a form of electromagnetic radiation, to create images of bones, organs, and tissues. Okay, next, second part. What is the definition of NDT, or non-destructive testing? NDT is a set of technique used to inspect, test, or evaluate materials, components, and structures without causing damage or altering with their integrity. That's all for the introduction. Thank you.
Assalamualaikum and greetings. My name is HUSNA MAISARAH binti JAMIL, student ID 20216066102, and today I will be presenting the self-awareness part of this video presentation. Based on what Abu has presented, radiographic testing is one of the many methods of non-destructive testing. Like the name suggests, radiographic testing uses X-rays or gamma rays to examine the internal structure of manufactured components to identify any flaws and defects. It is known that both these rays are forms of electromagnetic radiation which can be harmful to health if exposed to us in high levels. Radiographic testing is dangerous in a way that it can pose certain risks if it is not performed with proper precautions. A few reasons why radiographic testing is considered dangerous are as follows. The first one is ionizing radiation. X-rays used in radiographic testing are a form of ionizing radiation. Prolonged or excessive exposure to ionizing radiation can increase the risk of cellular damage, DNA mutations, and the development of cancer. However, it is important to note that the radiation dose used in diagnostic radiographic testing is typically low and carefully controlled to minimize risks. The next one is cumulative effects. Repeated exposure to ionizing radiation over time can have cumulative effects on the body. Frequent or unnecessary radiographic examinations can potentially increase the overall radiation dose received by an individual, leading to a higher risk of radiation-related health issues. The third one is fetal risks. Pregnant women should exercise caution when undergoing radiographic testing. The developing fetus is more sensitive to radiation, and high doses of ionizing radiation during pregnancy can harm the developing embryo or fetus. Whenever possible, alternative imaging techniques that do not involve ionizing radiation, such as ultrasound or magnetic resonance imaging (MRI), are preferred for pregnant women. Last but not least is improper shielding or equipment. If the radiographic equipment is not properly maintained or shielded, there is a risk of radiation leaks or malfunctions that could increase radiation exposure for both the patient and the operator. Adequate shielding, maintenance, and regular quality assurance checks are necessary to minimize these risks. Next is, how is radiographic testing important? Radiographic testing, also known as X-ray testing or radiography, plays a crucial role in various fields and industries for several reasons. The first one is diagnostic tool. Radiographic testing is widely used in medical settings to diagnose and evaluate a wide range of conditions and injuries. X-rays can help identify fractures, tumors, infections, lung diseases, and other abnormalities within the body. They provide valuable information that assists healthcare professionals in formulating accurate diagnosis and developing appropriate treatment plans. Next is security and screening. X-ray technology is widely used in security applications to screen luggage, packages, and cargo at airports, ports, and border checkpoints. Radiographic testing helps identify potential threats, such as weapons, explosives, or contraband, enhancing security measures and ensuring public safety. The next one is treatment planning. In medical radiation oncology, radiographic imaging techniques like computed tomography scans are used to create detailed 3D images of a patient's anatomy. These images assist radiation oncologists in precisely planning radiation therapy treatments for cancer patients. They help determine the optimal radiation dose, target the tumor accurately, and minimize exposure to healthy tissues. Last but not least is monitoring progress. Radiographic imaging is valuable for tracking the progress and effectiveness of certain treatments. X-rays and other imaging techniques, such as fluoroscopy or mammography, allow healthcare professionals to monitor the healing of fractures, the progression of diseases, or the response to therapy over time. These images provide a visual record that helps guide treatment decisions and assess the outcomes. Next, I'm going to talk about the advantages and disadvantages of radiographic testing. The advantages are, it is a type of volumetric inspection, which means it can detect surface and subsurface flows. It holds permanent records. It's a good quality control method. It's suitable for inside and on-stream inspections. It is suitable for many different material types, and virtually no surface preparation is required. The disadvantages of radiographic testing are it uses bulky and heavy equipment, has radiation hazards, testing area needs to be controlled access, it may not detect critical flows, and the results require interpreting by an experienced person. Also, it is not suitable for certain configurations, like joints.
Greetings, I bid to Madam Shirley. My name is DAMIA, student ID 20216166854, and today I will be presenting for social responsibility of radiographic testing. Radiographic testing has long been a widely acknowledged method of non-destructive testing due to its amazing precision in identifying faults such as cracks, thickness variations, corrosions, and material degradation. However, did you know that analysts must be mindful of the inherent safety risks with RT? Radiation, which is particularly ionized radiation, is the primary hazard of RT. High levels of radiation exposure can cause the following symptoms, which are hair loss, nausea, vomiting, and hair or skin loss. As a matter of fact, the National Center for Biotechnology Information, which is NCBI, investigated a case in Taiwan in 1999 in which NDT analyzers were exposed to industrial radiation during an inspection. Crew members suffered from debilitating illnesses such as tissue degradation and low blood cell counts. While such significant radiation exposure is thankfully uncommon, this cautionary tale emphasizes the potential seriousness of radiation illness. How do we avoid from accidents caused by radiographic testing to happen? It should be understood that RT might take time and must be carefully interpreted. Analysts may require a dosimeter and a Geiger counter prior to testing to monitor and measure radiation levels. Furthermore, all workers must follow central guidelines issued by organizations such as the American Society of Mechanical Engineers and the American Society of Non-Destructive Testing. The best method to avoid accidents and radiation exposure is to follow protocols from start to finish. The analyst must also guarantee that anyone who is not involved in the testing stage is kept away from the testing site, and most importantly, managers and analysts must ensure that employees are truly trained before beginning a radiographic test to reduce the potential of a major accident. A level 2 or 3 analyst is required not only to correctly prepare the test, but also to assess anomalies within a structure or well. That's it from me. Thank you.
So for the last part, then conclusion. To summarize, yes, radiographic testing is considered a form of non-destructive testing, NDT, even though it comes with a bad negative or side effects. Patient or users need to follow all the protocols or procedure from the beginning until finish, to avoid or prevent from experiencing the negative effects. That's all from me. Thank you.
These are some of the references that we use in completing this video. With that, I thank you.